Well, good afternoon, everyone. Welcome to Brain Injury Canada's webinar, Exercise and Brain Injury. My name is Michelle McDonald, and I am the Executive Director of Brain Injury Canada, and I wanted to welcome everyone here this afternoon and morning, I guess, in the Western provinces. Before we get started, I just wanted to go over a few housekeeping items. All attendees have been muted, but we do want to hear from you. You can submit questions through your control panel. Questions will be held to the end of each presenter, and we will endeavor to answer all of them. If we do, in fact, run out of time, we will ensure questions are answered and sent out after the webinar to the attendees. The webinar is also being recorded, and all attendees and all registered attendees and those who have registered will be sent a link. It will also be hosted on our website to view anytime. All right, let's get started. Our first speaker is Enrico Quilico. He is a doctoral student at the University of Toronto in Rehabilitation Sciences and runs a community-based exercise program for people with moderate to severe traumatic brain injuries. His undergraduate degree is from Concordia University in teaching English as a second language, and his graduate degree is from McGill University in Technology and Physical Education. Enrico teaches English, phys ed, and nutrition at the CEGEP level. He has also been working in the fitness industry for 10 years through the YMCAs of Quebec, where he specializes in corrective conditioning, functional fitness, and sport-specific performance. Enrico competes for Master Swimming Canada, where he has held titles at both the provincial and national level. He is a marathon runner and also competes in triathlons at the Sprint Olympic, Ironman 70.3, and Ironman 140.6 level. Those are in miles. Oh, that is incredible. In 2016, he completed the Lake Placid Ironman and rose over $10,000 for Brain Injury Canada, which we are eternally grateful for. So thank you for being here, Enrico, and I am going to pass the screen over to you.
Thank you very much for the kind introduction, Michelle. What a pleasure it is to be here. Thank you very much for the invitation. So today I will be speaking about the importance of exercise after traumatic brain injury. I won't bother going through all those introductions again about my background and studies, but perhaps I'll just mention one other thing that I don't always include in my bio is just that I'm coming from a place of knowledge, insider knowledge, because 12 years ago I was involved in a motor vehicle accident that resulted in a severe traumatic brain injury on the highway. So I went through the system here in Quebec. I was in hospital for about 2-3 months, and then I was in inpatient rehab for another 2 before continuing with outpatient rehab for up to 2 years after the accident. So altogether, that was a big chapter in my life, and it's very much my connection to a lot of this research, and specifically with exercise. I would have to say that while I was a patient in the inpatient rehab setting at the Montreal Rehab Institute, there was a time when somewhat of a shift happened in my recovery, and I made a decision. I was inspired, and I made a decision to make to allow this event in my life, which was by far the worst thing that had ever happened to me, be something for the better. That it was somewhat of a changing point, a turning point in my life, and for the betterment. So I started viewing things differently, almost as though I had a second chance at my life, and I completely changed. I certainly wasn't a teacher before the accident. I did not do very well in school. I was not very serious about my future. I certainly didn't participate in any endurance sports or was very physically active for that matter. I was pretty sedentary. So all of these things changed afterwards, and one of the biggest one of the most inspiring aspects of that place and that time when I kind of made that shift or decision was having access to a gym at that inpatient rehab center where I was able to, work out whenever I wanted, because I had lost, about 70 pounds after the accident, and as a result of lying in a hospital bed for 2 months. But the photographs of athletes with disabilities around that gym were a huge inspiration for me to gain back what I had lost and improve and go further than I had ever done before. So just as a precursor, that's what I'd like to say. So this is very close. I'm connected to this research. I'm connected to this topic, and it's an absolute pleasure to be here and speak about it with you all today. So the outline of this presentation is basically going to address the impact of traumatic brain injury in global terms. I'm not going to go into too much detail about that because I think that the audience is already already quite familiar with the impact of TBI as well as the definition of TBI. But I will go into more detail about the benefits specifically involved with exercise and physical activity after traumatic brain injury, which will bring me to my graduate research when I did my master's at McGill in kinesiology and phys ed, as well as some other literature which is related to the kind of things that allow and prevent people from exercising after having had a traumatic brain injury, and how that led to this initiative that I've been involved with since 2017, so now second year running, a multi-sectoral community-based initiative, which is the Adapted Exercise Program. And I will finish off by explaining how this Adapted Exercise Program is the premise of all my doctoral research and what the plans are for the future and who is involved. So with no further ado, everyone knows about the definition of traumatic brain injury. I'm sure I'm not explaining or mentioning anything new here. This is a particular definition that I'm quite fond of, although it's dated to 1995. I think it does a good job of explaining and defining exactly what a traumatic brain injury is. And then with the severity at the bottom, the different classifications of severity based on Glasgow Coma Scale, which is measured immediately after injury, if possible, would really classify your different levels of TBI. And with an MTBI, so a mild TBI, really being at one end of the spectrum for concussions, and then at the other end of the spectrum, severe traumatic brain injuries, which are 8 or less on the Glasgow Coma Scale. So the reason I include this is just to mention that my research really involves, and this talk I'm giving today really speaks more about individuals who have had moderate to severe traumatic brain injuries. And although every single brain injury is different, and every single recovery is different as well, we tend to see more injury-related impairments and long-term sequelae after the more moderate and severe cases. So traumatic brain injury it's astounding. It's an astounding figure to think that it's the leading cause of disability for people, under the age of 45 in Canada, and that by 2020 it's expected to be among the leading causes of death and disability around the world. It really is astounding. And it's no wonder, when you think about the leading causes of traumatic brain injury, falls and motor vehicle accidents. Falls really being reserved more for younger population and elder populations, but that large amount of people in young adulthood, and predominantly males, because you have nearly twice as many males who are affected by traumatic brain injury as female, really fits into that category where motor vehicle accident is the primary cause. And of course, the long-term impairments associated with the injury that can extend for up to a lifetime after the injury itself. Whether we're talking about the cognitive disabilities or impairments, which are hallmark of traumatic brain injury, associated to memory, concentration, processing speed, or we speak about the psychological impairments related to depression, which is the leading psychiatric disorder following brain injury, and statistics that state that individuals who experience traumatic brain injury within the first 2.5 years will experience major depressive disorder. And that's across all severities. So that includes people who've had concussions all the way up to people who have had severe traumatic brain injuries. You lump them all together and you say within the first 2.5 years after injury, nearly 50, half of those people are going to experience major depressive disorder. It is astounding as well. And then you look at the sociological impact that that might have, and the resulting sequelae and the resulting impairments, and how that plays a factor on an individual's regulation of their behaviors and their emotions, and the kind of effect that has on their ability to return to full-time employment, and the kind of effect that has on their interpersonal relationships, whether it be with their spouse or their partner, or with their children or their family. And of course, without any, without having to mention the extremely high reduction of leisure activities after injury as a result of all these impairments and results from the injury itself. So now I'm going to transition into speaking a little bit more about the benefits of exercise after traumatic brain injury, because this is really where the crux of my research interests lies. And when I was first exploring or investigating the literature, reading the literature about exercise after brain injury, I was so excited and thrilled to start reading about all these studies that have been conducted over the past 50 years that relate, that speak to the benefits of exercise after brain injury. And so if we take a look at some of the animal studies that demonstrate that, exercise is related to the upregulation of proteins in the brain that are related to neuroplasticity or anti-apoptosis, so it's preventing cell death, programmed cell death. The human studies that demonstrate that, cardiorespiratory endurance exercise is associated with a number of different benefits, namely in the physical spectrum, with the aerobic capacity and fitness of these individuals, not to mention the mood and the quality of life after traumatic brain injury, the sleep, the participation in the community, quality of life, the decrease in depression, and that even depression is the preferred method of treatment for individuals who have had traumatic brain injury. So that we're not only talking about a huge amount of literature which backs the importance of exercise after brain injury, but also speaks to the fact that it's safe, it's feasible, and it's also the #1 choice for individuals who have had traumatic brain injury in order to deal with a lot of these problems. So this brings us to the next point. What I'd like to mention or speak about is really the barriers and experiences of physical activity after traumatic brain injury. So this would regard the kind of things that prevent and allow people from exercising after a head injury. And there's been some research in the area that was really, I think it's really led by one of the experts in the area, a gentleman named Simon Driver, who explored or who examined the barriers of physical activity for individuals who had recently suffered a TBI, but did so in a rehabilitation context. And then went on to do another qualitative exploration of the same kind of phenomenon of what's going on with these barriers that are experienced by people who have had brain injuries from exercising. But both Driver and Self, the lead authors of these two studies, were conducting their studies in a time when individuals were still in the rehabilitation setting. So yes, their findings were definitely relevant in terms of, discovering or stating or discovering that, people experience a large or an increased amount of barriers related to their traumatic brain injury, related to their disability, that they have, misconceptions about the different what represents physical therapy and what represents physical activity, and how they're different, and when one finishes, when one continues, and how that plays a role in recovery. But the main thing that was missing in this area of research was the fact that these researchers did not explore the phenomenon when individuals were in the community, no longer in a rehab setting, so no longer supported by rehab professionals in a clinical setting. So that's where I came in with my master's research, and soon to be published hopefully this year, which was really exploring what allows, what prevents, and what it's like to experience physical activity and exercise for individuals with TBI, specifically in the community, so at least 1 year after rehabilitation. And I followed an interpretive phenomenological analysis without going into too much detail, because this isn't a research presentation, allowed me as the primary investigator to use my lived experience of having had a brain injury and also having been involved with an excessive amount of exercise after my brain injury, to explore the phenomenon for these individuals from a very objective point of view, but then go on to interpret the findings from an insider point of view, to add an additional lens to how these individuals interpreted their own experiences of exercise in the community. Again, I'm not focusing on the results. It's not a research presentation, but among the higher order themes that emerged from this interesting study that I was involved with in over 2014, 15, 16, and now to be published in 2018, was unsurprisingly the impact of traumatic brain injury, that it really had this life-altering impact on every one of the participants' lives, and who discussed the kind of changes, whether they be physical changes or cognitive changes and emotional changes. But here we get into the more interesting aspects of this study, which are in theme 2 and 3 and 4, where individuals were speaking about a very particular personal development that had happened after their brain injury, that involved accepting their TBI-related impairments and having this personal growth. And what was most interesting to me was how this happened alongside exercise and their participation in physical activity and sport. For example, individuals would talk about how their abilities had changed, compared to before their injury when playing a sport like hockey, for example, and that how that played a role in them accepting their post-TBI identity through ability, sports like hockey or whatever else they might be involved with, how it was almost like a tool. Now, theme 3 obviously spoke to the facilitators and barriers of exercise after the brain injury, which was the main, question of this research. And among the many, many examples and factors that were discussed by all the individuals, perhaps the most interesting thing which emerged was the fact that a number of these factors could both be a facilitator or a barrier, depending on the condition that these individuals were in, not their personal condition, but depending on whether or not that condition was available to them. So, for example, you might have something like planning. Without a concrete amount of planning for that exercise, you would have a barrier, to being able to go and participate in regular exercise. But then on the other hand, if they were very effective about planning their exercise routine throughout the week, then that thereby became a facilitator. So these different factors, which could, to some degree, create this optimal environment from which individuals could as they participate in more physical activity. So theme 4 was the individual speaking about all the benefits related to their participation in exercise and how they use the exercise as somewhat of a tool, to help them and help manage their TBI-related impairments. Now, I identified enormously with this one because for the longest of time, exercise has been my tool to help me manage a lot of my TBI-related impairments, and in my opinion, help me improve a number of them as well. But one of the most important things that came up was this pressing need for more exercise support in the community post-rehabilitation timeframe. So this is what led to the recommendations that we made about long-term interventions to explore the full breadth of benefits available through exercise, that some sort of support in the community would assist in the transition from rehab to the community itself, and that it may indeed be a valuable extension to the continuum of care for people who have had traumatic brain injuries, again, following their rehab and following their stay in the clinical setting. So that said, this really establishes a need for physical activity programs specifically designed for the TBI population. And despite all these barriers and that people are experiencing, these community programs may indeed be a low cost and effective option to, improving the long-term outcome after TBI. So Driver and colleagues, again, a leader in the research in this area, really spoke to the importance of identifying barriers and motivations and facilitators to exercise after brain injury. And as a first step in developing this kind of program, we also have some recent literature from just 2 years ago, which established that individuals are very able with moderate to severe TBI can definitely exercise independently in a community fitness center. In fact, this last study, Devine and colleagues, 2016, involved individuals with moderate to severe TBI leading their own exercise programs in a downtown YMCA facility. So the aim of all my doctoral research is about developing a program that offers individuals with moderate to severe TBI a place where they can go and exercise independently in the community. And it's built upon a pilot program that we started in 2017 that's been sponsored by the YMCA's of Quebec in collaboration with the Community TBI Association here in Quebec called the Association Québécoise des Traumatisés Crâniens, and another association called the Association Québécoise pour le loisir des personnes handicapées. Okay, so the Quebec Association for leisure activity for people who have had handicap or people who have disabilities in Quebec. We started the first cohort in 2017 with 12 participants, all with severe traumatic brain injuries, and we started the second cohort in January of 2018, so just not so long ago. And this time what we did is we welcomed 8 new participants, and we retained 4 people from the original cohort last year who have remained in the program as mentors, peer mentors, who are there, and they're these 4 incredible individuals who are passionate about the program, and they are leading the program. And the program happens twice a week, and I'm there every time, and I see these individuals taking part in this phenomenon, and it's incredible. So it's a 9-month program essentially that involves group and individual fitness training, all available through the YMCA, as well as team building and socialization activities before and after training sessions. So we always meet at the end of the training session every Tuesday, Thursday morning to stretch together, to do our abdominal work at the end of the session, our core work, do some stretches, and speak about what we're doing that week and that weekend. And it really follows a 3-phase kind of approach whereby we take in the first 3 months these individuals and introduce them to basic training in a separate techno gym area, which has a lot of machines in the downtown Y. Then we bring them to phase 2, where we introduce them to the rest of the YMCA community in the larger gym, and encourage them to explore all the different classes and programs available through the YMCA, like aquafit or yoga or tonus classes or what have you. There's just a huge amount of classes available for free to them. And then phase 3, where I specifically train these individuals. Okay, I put them all in individual programs, and they all run each one leg of a race, and it's an indoor triathlon that happens in November at the downtown Y. Happens to be a fundraiser, and it happens to be the big indoor triathlon event at that Montreal YMCA. So this was the cohort from 2017, 12 individuals, started off, orientation, introduction to the basic YMCA. Techno gym area, they're working with machines and equipment, supervised training, they're following programs that are on these little technical keys that allow them to plug in the keys, see what they have to do next, then go to the machine, and then follow the program effectively. Team building activities afterwards, where we go into a studio, do the abdominal work and the stretching. Bringing them and introducing them to the rest of the gym community on the 3rd floor, the larger gym, and all the other classes that are available at the Y. And then finally training them for this indoor triathlon event. And of the 12 participants that I had in that first cohort in 2017, 9 of the 12 participated in the indoor triathlon, and they secured not only the second, they secured a first and a second spot in their individual categories. So amongst, geez, I think we had about 50 people, or give or take, amongst the 50 people who were involved in this triathlon, indoor triathlon, these guys were able to secure a first and second spot in their individual category, which was just astounding and by far, like exceeded everyone's expectations. So the objectives of the program for the next 2 years are really co-creating the program itself, developing a set of clearly defined protocols for how this program starts from A to Z, working with the community partners, figuring out how we can keep this program sustainable after it's finished, and of course exploring the impact of the program and what kind of effect it has on the participants, as well as the mentors and the people at the Y. The next 2 years is really to implement a feasibility study, so somewhat of a trial that explores and investigates how this program can have a measurable impact on these individuals' lives, their mood, their quality of life, their long-term rehabilitative outcome. It's going to be about disseminating the findings through published articles and presentations to other YMCAs in Quebec. There are 9 other facilities in Montreal. Certainly other people with brain injury in the Montreal area, and then evaluating the information required in order to run a larger trial, which will hopefully take place in the near future, possibly after 2022. So Cohort 2, I introduce you to the individuals who are with us now, 4 peer mentors and 8 participants who are in the program. You have your 2 peer mentors, 2 of the 4 there who are leading a group, who are speaking to the others as we introduce the program in the studio that we have reserved. They're a phenomenal group, so excited to be part of the initiative. We've already transitioned now to the independent exercise phase 2. We're taking them outside. We're doing hiking activities. We have the opportunity of having Mont Royal, so Mount Royal, which is just north of the YMCA Center. Really not far from the downtown core, where we can literally just walk up the stairs, start hiking up the mountain, and benefit from all these beautiful things that we can do together as a group. And all together, this really represents a participatory research action research approach, whereby we're involving these collaborators from the community, the 4 members, the peer mentors who are involved with the program, the organizational representatives from the YMCA or the Quebec Association of People who have had head injuries, a team of multidisciplinary researchers, and every single one of those individuals plays a role in developing this program and making it what it is. So my co-supervisors are the Dr. Angela Colantonio from Toronto, University of Toronto. She's also the director of the Rehab Science Institute at the University of Toronto. Dr. Bonnie Swain from the École de Réadaptation at l'Université de Montréal, from Montreal, who I work with very closely here because I am based in Montreal. So I have the privilege of having these 2 incredible leaders in TBI research as my co-supervisors, as well as an incredible team of co-researchers, ranging from 2 just incredible researchers at McGill in the Department of Kinesiology and Phys Ed, Dr. Shane Sweet and Dr. Lindsay Duncan, who really focus a lot on sports psychology, and then a close friend and colleague, Dr. Sean Wilkinson, from the Department of Applied Human Sciences at Concordia University, as well as the YMCAs of Quebec, the director of the Downtown Y, Eric Trudel, the assistant director of the Quebec Association for People who've had brain injuries, Pascal Brodeur, the generous participants who are peer mentors in the program this year, Marc Saint-Onge from the Association Québécoise pour le loisir des personnes handicapées. And the strength of this initiative is truly found in the fact that it is all about gaining knowledge about the factors that contribute to more effective community-based exercise programs for these individuals, the fact that we have such a participatory approach, and all the potential that this program has for the future in terms of once it's standardized and formalized, that we can start bringing it to other locations, other places in the nation, possibly other places in the world, so that more people can benefit from exercise after brain injury. I have to recognize the external support that we have acquired for just recently found out this spring 2018 from Social Science and Humanities Research Council of Canada, so from SSHRC, a specific initiative which is called the Sport Participation Research Initiative, which is combined with Sports Canada, to really conduct research on matters related to enhancing participation for people of all backgrounds in sport and to the outcomes thereof in Canada. So thank you very much for your time. I welcome everyone to refer to the references at the end of my PowerPoint with all the information that I spoke about, and I look forward to any questions if there is time.
Okay, thank you so much, Enrico. That was lots of information, which is amazing, a lot of great information. So for those of you, we will be recording, so you don't need to furiously take notes. Also, we'll be sending out, our presenters have graciously offered to send out their actual presentation slides. We'll also be uploading this to YouTube so that people who require it can get closed captioning as well. So I do apologize, this slide did not come up earlier, but there's Enrico right there. And it looks like we do have a question. So Enrico, what, if any, is the relationship between research related to TBI and exercise and the potential contributions to post-stroke interventions and rehabilitation?
Can you hear me?
Yep.
Yep.
Good. Okay, so I would say that the connection between traumatic brain injury and exercise research and post-stroke research is very relevant because, as I'm sure you already know, you know, a stroke leads to a brain injury as well. It's just not necessarily traumatic. It's something that happens within the brain. So the kind of benefits that are obtainable from exercise after traumatic brain injury are not exclusive to trauma at all. They're exclusive perhaps to brain injury and not necessarily the cause of that brain injury. So whether it's an open head injury or whether it's a closed head injury, whether it's a moderate or a severe traumatic brain injury, whether it's a concussion or whether it's a stroke, it all relates to the same thing. It's still a brain injury that may be improved from exercise.
Okay. So I'm sure people are still gathering questions, so feel free to still submit questions. Oh, hold on. Sorry. So one question, is there a way to be part of this group, the one that's taking place in Montreal?
Mm-hmm. Well, I can say that anyone who is interested in participating in potentially future cohorts, because we'll definitely be running cohorts for the next 3 to 4 years, just based on the support that we've acquired from the federal government, then yes, there's definitely possible ways of, if you're an individual living in the community who would like to potentially be part of this group, then absolutely, I would invite you to contact me or perhaps to contact Michelle through Brain Injury Canada, who can then forward your question or your information to me so that I can follow up and see about, you know, recruiting you possibly for the next trial, which would be taking place in 2019.
Okay, and so just there's a few more questions, so maybe we'll get to those. But one more thing, do you know if there's anything like this happening in other parts of Canada?
I am not familiar with, I'm familiar with exercise or physical activity programs that are run in other places in Canada. There's a phenomenal program called the Time Program, which is in partnership with Parks Canada, that's run in Toronto and Ontario. Every single, you know, brain injury association across the nation, I'm sure, has some form or degree of physical activity involved with their programming, because, you know, it's no secret about the benefits associated with exercise and physical activity after brain injury. But that, I would say, is about the extent of my knowledge in the nation. I had a conversation with Dr. Simon Driver several months ago, about half a year ago, let's say, perhaps even longer. It was really a pleasure to speak with the individual, as I'm quite a fan of all his work. And it's my understanding that in the west coast of the United States, or central United States, that they are developing a large scale program that is run through YMCAs as well, that offers individuals with traumatic brain injuries a place very similar to this one, somewhat of an extension to rehab and the continuum of care, a place where individuals can collectively reunite and exercise in a place where they feel comfortable and safe and can collectively benefit from all the improvements associated with exercise after brain injury. So that's about the limit to my knowledge in terms of the nation and outside of the nation. But I'm sure that more information is just a finger click away on Google or wherever else you might be looking for that kind of information.
Okay, and thank you. And Brain Injury Canada will keep on top of that and send out any information that comes to us. So I do thank you, Enrico. In the interest of time, we do need to move on to Mandy. So if just whoop. So I would like to introduce Mandy Shintani. Mandy has been an occupational therapist for 30 years and has her master's degree in gerontology. She is an international conference speaker and recently presented at the International 200 Years of Parkinson's Disease Conference in Australia, the National Fall Prevention Conference in Toronto, and provided a poster presentation in the UK at the ACPIN Neuro Conference. 12 years ago, she developed the ACTIVATOR poles, patent pending, and techniques specifically for rehabilitation based on the concept of Nordic walking. 3,500 therapists and instructors in Canada, as well as Australia, UK, Ireland, and USA, have completed the courses she developed on the use of Nordic walking for fitness and rehabilitation. She has been featured numerous times in national media, including the Globe and Mail, CBC Early Edition, and the Toronto Sun. She was a finalist in the prestigious YMCA Women's of Distinction Award for Innovation and Entrepreneurship. Okay, and I'm going to pass it over to Mandy and give Mandy a warm welcome.
Thank you so much, Michelle, and I'm very excited to be here. Thank you so much for Brain Injury Canada for allowing me this opportunity to present, and excellent presentation, Enrico. Thank you so much as well. I learned a lot. So today I'm going to be talking about active living for brain injury through specialized walking poles. So a lot of people ask me as an occupational therapist, why I've spent the last 12 years really talking about the benefits of using walking poles, not only for fitness, but also for rehabilitation. And it was really introduced to me through my Swedish neighbor. As you know, the Scandinavians are well known for a very healthy living style. And my neighbor indicated to me that walking poles were used by people of all different ages, all different fitness levels. I had never heard the concept before, but when I looked at the research, like right now, if you were to go on PubMed, you'd actually find that there are 240 independent peer-reviewed studies on the benefits of using walking poles. And I'm going to talk about how that specifically helps people with traumatic brain injuries. So here's a picture of myself when I first tried it out. And it's highly effective for core muscle strengthening. But one thing you can see by this picture here is look how much it increases the gait stride, your walking stride, your speed, nice upright posture. So a lot of areas that we're trying to improve when we're working with people with traumatic brain injuries, as well as, Enrico, I'm glad you mentioned like stroke clients as well. And it just another picture here is me polling with my father, who is 93. He absolutely refuses to use a cane. He can only go about half a block now, but the fact is that we're able to pole together. He really enjoys being outside. Like Enrico mentioned, there's a lot of research showing the benefits of exercising outside. And it's just about just mobilizing at whatever level that you can do. So I want to talk about polling versus walking. So walking is probably the most researched area. I love walking. I'm an avid walker. It's convenient, it's easy, it's something you can do on a daily basis. But what I'd like to talk to you about are what are the benefits when you add on poles. So you can see in this photo here, the muscles that are outlined in blue are the muscles you use for your lower extremity. But if you look inside, those are all the muscles that you use when you use walking poles. So it's excellent in terms of recovery in that it is a tool that is providing you with a full body workout that I mentioned. And the other really neat thing is that it is actually mimicking the same movements as a normal walking pattern. So often after you've had a brain injury or another orthopedic injuries or stroke, getting back to a functional walking pattern is one of the key factors that is you were trying to achieve in rehabilitation. And you can see there, look how much it's emphasizing increased arm swing. As I mentioned, highly effective for core strengthening. Every time you press down on the base of the pole, you're actually resulting in a contraction happening in your abdominal muscles. So, for example, if I were to walk for 10 minutes, I would actually obtain 1,000 core contractions happening in my abs. So just a very easy, simple way to obtain core contractions versus doing something like sit-ups, for example. You've got that bilateral support, so increases people's confidence for walking. They can do it on different terrain. And as I mentioned, one thing I think is so neat about it is that it is a tool that you can use every day independently to work on your own recovery. And I just want to talk about how the polls really touch people in a holistic viewpoint. So I just want to talk about John here. John is someone who sustained a significant brain injury. He was a high level athlete for hockey, for running, and one of the things that he really liked about the polls was that he wanted to get back to just being physically active. So he wasn't able initially to do some of the sports that he could do previously. So the polls gave him an opportunity just to feel more confident, have better balance, just to do walking. And it's neat how that lend itself also to then being able to hike again, to snowshoe, to travel and do day trips. So you're starting off with walking, but you're going to grow to other areas. The other thing that was really significant for him is that just like how I do polling with my father, John was able to do it with his other family members, his spouse, his friends. And so it's an activity that you can still continue on to do within your community and with your family friends to get that social support, to be out, being active. And it's also something you can do right until, like my father, till you're 93. I am in my 50s. I pull all the time. And it's just itself a tool that lends itself not just to your period of recovery, but the importance of being active really for the rest of your life, for all of us, whether you've had an injury or not. So here is what Leah Monday had to say. She's an occupational therapist that worked with John. She said, awesome tool for physical and functional goals. We worked on improving walking tolerance, and it gave them also a chance just to talk in a very natural settings where it just felt much more comfortable for John to talk about his concerns. You can see he's got nice upright posture. It improves coordination and just awareness. John had a weakness in one side. Because you've got something in both hands, it really forces you to be aware of that bilateral movement. And John wasn't swinging his arm, which I'm going to show you in a few minutes. And what Leah found is that there was just less verbal cueing required. One of the things that John talked to me about very early on when I started using the polls, and I always mention to this day, is that one of the things he really found that was helpful is that if he didn't see the handle, that black handle within his visual field while he was walking, he knew he wasn't swinging his arm and he knew he wasn't getting the core strengthening that he really wanted for exercise. And so he used that visual cue to provide him with a mechanism for recognizing how to make his walking pattern more normal. Okay. And the other thing I really love about using the polls versus any of the devices is how much it makes people feel about the perception of ability versus disability. That, compared to a cane or a walker or crutches, that people get poles in their hands and they've often said to me, oh, I see, you actually want me to exercise. And it's like, yes, like this is going to give you some bilateral stability and balance, But what's really key is that it's going to allow you to continue on to exercise. And people love that perception. Um, Compared to using other devices. And Ian, who is a brain injury survivor and a huge advocate for people to be outside and stay active, he said the poles allowed me to walk a greater distance to do the things I love, like hiking. Many people with a multitude of disabilities are stuck at home, and I think many can and should be able to get out. So Ian right now is earlier in the day able to walk about 2 kilometers with the poles. He does use a scooter for later on in the afternoon when he has more fatigue. I think that's a great example of that. It doesn't have to be all pole use or all walk use. There's a multiple use of devices that you can use to fit your needs. Um, but he's found it as a great activity that he can go out into the woods and hike with his son and stay active in that regard. Ian's indicated he's actually put over 100 kilometers on his poles during his recovery time. So I just want to talk to you about some of the issues or pet peeves I have about canes and some of the benefits of using poles versus canes. So the issue with canes is that in a lot of ways, it's facilitating some of the dysfunctional walking patterns that that people get as a result of brain injuries, whether that's stroke or traumatic brain injuries. And that is because essentially what you're doing is you're having the person have a device in their non-affected side or their stronger side that is really making them pay more attention. So you've got a visual, a sensory, because it's in their hands, a proprioceptive cue, because they can feel it landing, that moves that person's attention over to their stronger side. Whereas you really want to look at conditioning being bilateral and you moving both sides in a coordinated manner. So you can see here you have less arm swing, particularly people who have had a stroke. They end up leaning on the post. They do a thing called hip hiking where they swing their leg over instead of bearing weight on that other leg that isn't as strong. And again, there's that perception as well. You can see you stoop more forward, um, and in here you're getting a bit of trunk rotation as well. Okay, so for the rest of the webinar, what I'd like to talk to you about is some of the research I think is more relevant to brain injuries. I'm going to talk to you about a different technique that you would use rather than the standard Nordic walking, or we've coined it as urban poling here in Canada. Some of the guidelines that you'll use um, to make it more, to transition to using the poles in a safe manner. And I also want to show how you can use the poles for doing both seated and standing exercises for improving balance and strength, as well as there are lots of training programs as well for learning for healthcare professionals on how to utilize the poles. So in terms of the research, as I mentioned previously, there are 240 studies on PubMed on the benefits of walking poles. And on the activator poles that we created for rehab, there are 8 studies. 7 are done in Canada and 1 is done in the UK on posture. So one of the studies I'd like to talk to you about is a recent study that was done on stroke in 2016. What they were doing was they were comparing Nordic walking with a group that was just doing walking. They did this on the treadmill, which I don't recommend you do independently. I think it's a bit of a challenge even with a therapist, but this is how it was done in this particular study. But what they did find is that mobility, balance, and activities of daily living, such as bathing, dressing, um, mobilization, there were better improvements with people who did Nordic walking versus walking alone. They found it really helped promote the arm movement as well as that opposite arm and leg movement as well. For Parkinson's, again, I don't have a study that has been done on brain injury, so I'm just using other studies where there's some similarities to some of the symptoms people may be experiencing to other conditions, to like brain injuries as Enrico had mentioned earlier. So in terms of Parkinson's, they had 3 groups. One group was doing Nordic walking, one group was doing walking, and one group was doing flexibility, balance, and strength exercises. So all the groups, they found improved balance, improved reduced pain, and improved quality in life. However, when you looked at utilizing poles, that was superior to the other groups in terms of posture, in terms of increasing that stride length, normalizing their walking pattern, and gait variability. So how much variation there is in the way that you walk, which is related to falls as well. So the more variability that you have in your walking ability, the more likely you are at risk for falls as well. So mood and depression is another area where a lot of clients with brain injuries also wrestle with. And here are a couple studies, again, with comparison with walking. Again, walking is an excellent activity, but there was an improvement, additional improvement using with poles in terms of mood. This bottom one, less fatigue, decreased depression and anger compared to walking alone. And that's because you do get more of a full body workout, so you're probably getting more release of endorphins. You're increasing your cardiovascular workout by about 25%. And you're also walking outside, which, as I mentioned, has lots of additional benefits for mood and for exercise. Okay, so what I'd like to talk to you about is the use of Nordic walking poles and a different technique that creates more balance and stability than the standard technique. So in terms of the poles, um, they had mentioned earlier that we had developed the activator poles specifically for rehabilitation, but really you can utilize any type of pole within this. The main thing is that you want to make sure that it is a high quality pole. I always cringe when I hear therapists or fitness professionals, they just go out to, Walmart or Costco and pick up a pair of poles. The reality is that you're going to do a lot of weight bearing on that pole. Um, you're also going to be pressing down on it for core strength and balance. And you don't want to have a cheap pair of pole that's going to slide when you weight bear on it, that there's going to be a lot of rattling. Um, we developed it with an ergonomic handle that you can actually press down on, and it's strapless. They have found a study that was done in Germany that shows that strapless strap poles results in the highest rate of injury, which is a skier thumb injury. But the main thing is that, yeah, that you do have a pole that is good quality and that it can last for you, and um, it won't break. So what I'd like to talk to you next about is the activator technique. So usually when you're doing Nordic walking, your pole is on a diagonal. What you can see in this photo here is that if you keep the pole vertical, what the research shows is that you will create a situation where you can put more weight on it. It will provide you with more balance. You can offload more on the poles when it's in a vertical position. So if you have a lot of back pain, maybe you've also injured your hips and knees, you can also use the poles to offload that weight to reduce your pain. The way that you can keep your pole upright is by doing what this lady is doing here in the picture, and that is by bending your elbow. You still want to lift that pole. You can see here it's still opposite arm and leg, which is the same movement as functional walking, and you want to lift that pole about the same distance as the front foot, as you can see here. But there is a video on our website, which is just a couple minutes, that does show you how to adjust the poles to your proper height, but also how to do the technique. And for those clients who have a very mild symptoms, you may be able to move up to the urban polling or the Nordic walking instructions. That is also on the website under getting started, or it may be something that you eventually can work up to later on in your recovery. So what I'd like to do is just show you how John changed with the use of walking poles. So what I'd like you to notice in this video is just the lack of arm swing. So this is John just walking along our ambleside, and here he is with his therapist, and you can see nice coordination, nice movement of both arms. And as I mentioned earlier, every time John is lifting that up, he's also getting that core strengthening that he was seeking. Oops, sorry, this is running again. So I'm just going to move out of here and move to the next slide and come back here. Okay, so some of the guidelines that just make use of poles safer, more effective is if you're teaching it, keep the instructions simple, less distractions while the person is learning, because they really do need to focus their attention. It's one of the reasons why it's been a really good tool for cognition, because it involves new learning, it involves concentration. But that's, of course, easier to do when there's less distractions and less talking to the client. Don't emphasize opposite arm and leg whether you're learning, whether you're teaching. That's something that's going to come. It is something that is an automatic movement. If that's really been affected for you with your brain injury, of course, that's something that's involved in relearning. But if it hasn't, that is something that should come quite naturally. And I find if the person really emphasizes that, they're going to get discouraged with using the poles. I find it's easier to start inside because there's less, traffic and less environmental noise. Just gives you a chance to learn in a really safe environment, get the technique down pat before you head outside. Because there's more concentration required, you are more physical exertion, and you may be doing it socially. All of those areas are going to require more effort than walking. So you really want to start about 30% of the person's maximum walking tolerance. So they can walk for, 30 minutes, you want to start at 10. So you might even want to go lower, and then you want to gradually increase. If you're exercising, make sure you've got a sturdy chair or a sturdy wall behind you. The other thing you can do too is very similar to what I mentioned with Ian, is that maybe you don't use the poles for daily use because um, of the concentration and the physical coordination that's required. And you use another device, but you can continue to use the poles for daily exercise and walking. Okay, so that's one option. Another option is if you are quite severely affected in the one side, such as a stroke, this is the one time that we do suggest it would be easier to start with one pole for your daily mobilization instead of using a cane. And again, continue to exercise if you can with two poles, because your ultimate goal will be that you want to progress to two poles, but you may want to do that on a gradual basis. Again, this whole process may take years, but if you keep up with it and do it daily, you should notice um, a steady improvement, and at least a maintaining of your abilities. Some of the instances when it may be contraindicated, I do suggest an assessment by a therapist or rehab professional to help to determine that. But some of the areas where using a poles may actually become a tripping hazard if the person does have ataxia or quite significant problems with their gait pattern, poor coordination, which you think the poles become a tripping hazard. That's often why we'll recommend just one pole initially, but it's often safe to use two poles in a sitting and standing position. There may be cognitive limitation that poles use too challenging, agitated or aggressive behavior, which places the person or other people at risk. And again, the other option mentioned earlier was using the poles for daily exercises, but other devices for daily mobilization. Okay, so I've already mentioned some of the benefits of exercising with poles for mobilization, but for exercises, the same benefits apply. Nice upright posture, you've got bilateral support. It adds motivation and variety. So for one thing in the research, what it shows is that for some reason, when you use poles, that motivates people to walk further, faster and more frequently. And the same thing seems to apply with exercises. It just gives people an exercise tool, adds more variety, allows you to use the option for applying a downward force for core, gives that something to do with bilateral movements. Again, visual and sensory cue to that weaker side, and home exercises programs become more versatile. The reason why I say that is often as a therapist, we'll tell people to, exercise by their kitchen sink because it provides that stability. But with the poles, if you've got a sturdy chair or wall behind you, you can exercise in your living room, or watching TV, or your bedroom. And hopefully it also allows you just to become more comfortable with pole use for the long-term use. So here's some sample sitting exercises. I actually took this from a fall prevention study, the Ortega study, and it's just some simple sitting and standing exercises that you can do. You can see nice upright posture, gives you some trunk control so you can go a little bit farther with range of motion exercises as well. And I'm just going to show you how you can use it for standing exercises. So this is with an assistance from a therapist, but hopefully you can progress to the point where you can do these independently in your home environment. So this is just weight shifting or balance exercises, side to side. The next one I'm going to do, I'm trying to get the clients to increase your balance by lifting up one pole or two poles at a time and standing independently. So she's doing it there at different heights. And then I'm getting her to practice a walking movement with the stability of the poles. And then I'm providing her with a little bit of support because I want her to work on some contralateral walking movements. So same movements as you do with normal walking, which is just opposite arm and leg. So these might be exercises that you do prior to actually even using the poles or just to improve your standing tolerance. And here I am, I'm getting her to roll her foot forward. So one of the main issues that we find for fall prevention that happens with aging, that happens with Parkinson's, with other brain injuries, is that people tend to walk more flat-footed. And what happens when you walk flat-footed is that it makes you more at risk for slipping and falls. But you can see here, because you've got that bilateral support, it allows you to bend your knee and actually lift up your foot so that you can clear your foot and do more of a heel-toe gait pattern.
Mandy, we're just we're a little bit over time, so if you wouldn't mind, we're already after 3 minutes after 1 o'clock.
Oh, absolutely. So actually, we're right at the end here. Just going to show you how you can do some bilateral activities with the therapist. So this is just us going back and forth. And the final thing I just want to say is that if you can find a walking group, the March of Dimes actually has lots of walking groups. I actually got this from Janice Combing from Brain Injury Services in Barrie. She's got a walking group going. She's trying to do a trial program. What she noticed is that walking in groups increase social interaction, motivation, and committed to participate in walking, and exercising, thus improving their physical, emotional well-being. Okay, so thank you so much, everyone, and I'll hand it back over to Michelle.
Okay, well, I do want to thank both Mandy and Enrico. Obviously, 1 hour is not enough time to cover this. We unfortunately do not have time for questions, but I do encourage people to submit their questions it's not there on the slide, but info@braininjurycanada.ca, and we'll endeavor to have these questions answered right after. So I do want to thank Enrico and Mandy again for taking their time and for sharing this information. I would also like to thank our generous sponsors who make these initiatives possible. Our gold sponsor, Bergeron Clifford Personal Injury Lawyers, and our silver sponsor, Zaire Insurance Brokers Limited. We couldn't do it without their support. And I'd like to lastly thank everyone for attending. We continue to have these webinar sessions, so if there's any topics that you're interested in hearing more about, send an email to info@braininjurycanada.ca. And as I mentioned, this will be recorded and available, sent out to all attendees and available on our website. So without further ado, I want to thank everyone, and I hope everyone has a wonderful rest of your day. Thank you, Enrico and Mandy.
Thank you, Michelle. Thank you, everyone.
Thank you so much, Michelle. Take care, everyone.
Bye-bye.
Bye-bye.